So we've got a few more minutes until we have our panel Q&A session. But I just thought if there's anyone that wants to ask any questions in terms of the GradConnect process of the presentation that I had before, what I'm going to do is I'm going to throw these speakers out. If you weren't here in the previous presentation, they're speakers, you just hold them up like this, okay, and then you can throw them to the next person. So,
I think I missed one of the question sessions. So very first thing this morning, if anyone wasn't here, you were explaining that the selection criteria and the application process, you get a scoring system out of 26?
Yep.
Yes, okay.
25.
25, okay. When we request our feedback, is that something we can know, like what our score was, so we can know if we're just off by like 1 or 2 points, and then we can reflect on, you know, maybe where it went wrong?
Yeah, so you can ask, they will give you feedback on if it's your selection criteria. They won't go into specifics into individual questions, okay, but they will give you...
so maybe by knowing if you got 24 or 25 or 20 out of 25, then... Yeah,
so you could ask for your score,
okay.
That's no problem, but they won't go into the specifics because obviously we have then broken down certain marks allocated, so we obviously can't give out the marking guide criteria, but yeah, you can certainly ask what your score was.
Oh, cool, all right.
Okay.
Wait,
sorry, I'm sitting down, my feet are a bit sore. We're a little bit early, but I can, if everyone wants to come up and no, that's fine. We can, but go ahead if there's any other questions for GradConnect. Yep.
Yeah, sorry.
Who's next?
Speaker. I know some other people had a speaker before me. All right. I spoke to you about the permanent residency and citizenship status because I'm not a PR.
Mm-hmm.
Is that purely to determine your work rights? Because I have full work rights with the visa that I'm on.
Sorry,
I
can
just
you
don't
repeat
have the
that again?
status.
Purely to determine
the work rights, because I have full work rights on the visa that I'm on. It's just not permanent residency or citizenship that I have. But is the work rights, is that what the issue is with? No.
It's actually about obviously preferencing permanent residents and citizens of Australia.
But again, I'm confused. You said we can still apply, but the preference goes to local people.
No, the preference is for local WA applicants in terms of interstate applicants. So interstate applicants, not international.
Mm-hmm.
So there's local, then there's interstate, and then there's international.
Yeah.
So we preference our local WA applicants first before interstate. Interstate are still eligible to apply, whereas international students who don't have permanent residency or don't have citizenship are ineligible to apply.
So if there's a tick box and we tick no, we do not have citizenship or permanent residency, it'll prevent you from progressing through the website. Is that what's happening?
It won't necessarily prevent you. You'll still be able to go through. However, the recruiters will be asking those questions and you'll have to provide the documentation.
Okay.
Any other GradConnect questions? Because we're starting our panel presentation in 10 minutes, so we need to make sure that everyone online has got the same access to information. So I'm just happy to answer some GradConnect questions. Yep.
Just one question. When you said you do the selection criteria, but you time out, does that mean can you save your application and go back to it every few days? To redo it?
Yes, you can save your application to go back. But what I have noticed in the past, we try not to do that, but it does time it out if there's inactivity.
All right.
Okay. So you can save it and go back to it.
Yeah. Okay. Thank you.
Yeah.
Just before, when you said don't withdraw your application, is it one application regardless of the 3 preferences, or are there 3 separate applications for each?
One application,
okay.
And you put 3. You ask for your first preference, your second preference, and your third preference.
So you don't really have the opportunity to tailor your application for where you're applying. That comes across in the interview process?
Correct.
Okay.
Yeah, and there's a question that was asked before in terms of does it affect your application if you haven't had a placement at that particular hospital? No, it doesn't, because we know that not everyone's going to have a placement at that hospital in that particular area. So you don't, the questions don't necessarily, they don't have to be tailored to a specific area.
Because the selection criteria are the same anyway, regardless of your preference of location.
Correct, yep.
Okay, thank you.
Sorry, just one more question. With regard to the grad program, can you still apply for the grad program and apply for the private Ramsay Health as well, which is separate? So you can do them both?
Yep. So you would have seen in my application I said some people withdraw because they get a job opportunity elsewhere. Usually it's because it's in the private sector and they've decided for whatever reason to take it in the private sector and they've withdrawn that application, which means the next ranked person in Grad Connect gets a go. Or it might be vice versa. You might have been offered at Ramsay and offered through Grad Connect for WA Health, and you've decided to take WA Health.
Okay, thank you.
So you don't limit your applications to just Grad Connect.
Yeah, that's what I thought. I thought maybe you just have to do one and not the
No.
others. But
So we are just the process for transition to practice programs in public hospitals or WA Health,
right,
Okay.
Yeah.
not
Thank
for
you.
private.
Okay, thank
Okay.
you.
Yes.
If unsuccessful, you said that we should keep our applications in the pool. When would be the best chance to resubmit? Because we would get feedback to alter your submission.
Okay, so we keep the applications in there. We say don't withdraw because at any time there's opportunities that come available. And I get calls all the time, Natalie, we need nurses here, or Natalie, the contact tracing team are looking for, graduate nurses. Who have you got in your pool? And I'll just send them applications. The next time you would need to apply is the next Grad Connect process.
So keep it in and then resubmit when you.
Yeah, resubmit. So even though I did say in the in the PowerPoint presentation that it's open for 12 months, because we're moving now to 2 separate intakes, we keep them in for 6 months. So then the next process you would apply then. Okay, but we're constantly going back to the pools to see who's still available. I mean, our last pool, which was a 12-month pool, we have gone back in there time and time and time again. There's not very many left in the pool. Okay, so it's important. A lot of people think that if you weren't successful and you withdraw your application, then it's not going to show, so it doesn't look like you've done badly, so you can apply again, it might look better. We see that you've withdrawn. It makes no difference to us if you haven't, you weren't successful the first time, because what we're encouraging you to do is to learn and improve. Okay, so it doesn't matter to us that you've applied before and you weren't successful. We're hoping that you'll learn from that experience, because not everyone will be successful in their first time applying to Grad Connect. It is a new process for you, okay, and it's new experience, to learn.
Thank you.
Any other questions about the general Grad Connect?
I'm sorry, just in our interview, should we be expected to remember the standards of practice? Like all of them? Would that be a question we're asked?
Do you know what? If you asked me every single standard of practice, I wouldn't be able to tell you. Okay. Mm-hmm. However, I know that there are. Okay, and I know what most of them are. So no, you're not going to have to know that specific information down to that level. You just have to know what they are and what they do. Mm-hmm. Would that? Yep. Okay. Yep. Okay. Yeah. Okay. Any other questions? Because we might start the question and answer panel early. Yes. You. Yep. Oh, up at the end. Oh. Okay, Kara's asking, I didn't see any mention of Joondalup Hospital. Is it correct that there are no placements at Joondalup? Joondalup is part of the private sector, and it would go through, they are Ramsay, okay? So it's not through Grad Connect, it's not through WA Health. All right. So we've got all the speaker boxes. All right. I'm going to let everyone introduce themselves. Okay, so what we'll do for those people who are online, we'll start with 10 minutes from the floor, asking questions. Please, if you can, direct your question to one of our panel members, obviously their area of expertise, and then we'll move to 10 minutes online and go backwards and forwards so that hopefully everyone's getting their questions answered. Okay, so we'll start down here.
Hi, so I'm Karen McCumpsty and I'm from the Armidale Kalamunda Group and I look after the graduate program.
Hi, I'm Jodie Atkinson. I'm from Women and Newborn Health Service and I'm the Graduate Midwife Coordinator.
Hello, my name's Sally. I'm the grad coordinator at Fiona Stanley Fremantle Hospitals.
Hi, I'm Kate Marwood. I'm the Nurse Graduate Program Coordinator from Rockingham Hospital.
Hi, I'm Dayshni Shaw and I'm a grad who's just completed their graduate program at Meriden Hospital.
My name's Mark. I'm the grad coordinator for the Wheatbelt.
Hi, I'm Lauren. I'm with WAX. I'm doing my graduate program currently at Northam Hospital.
I'm Charlene Latimer. I'm the grad coordinator for North Metro Mental Health.
I'm Cal Fletcher. I'm the clinical nurse specialist in the operating theatre suite at Sir Charles Gardner Hospital.
Michelle Dixon. I'm nurse manager for workforce at Charles Gardner Hospital.
So who's going to be brave enough to start off the questions from the floor? Anyone? Come on, we've got this expert panel. You can ask them any questions related to nursing and midwifery. Maybe we'll... Oh, okay, well done. Can someone throw the speaker? We just need everyone online to be able to hear your question, that's all.
To both the grads that have finished and during, what's been your biggest challenge working in the country hospitals?
Probably the biggest challenge is there isn't a lot of staff and it can be quite challenging to take that next step. You are supported along the way, but it is really, you need to be confident in your skills out there, but I believe you do have good support. It's just knowing that you can take that next step and challenging yourself. That's probably the biggest challenge, is knowing when to take that next step, I think, you know, in yourself. But yeah, I would recommend it to anyone, definitely, grad, yeah.
Most of the new grads that have just started in March are worried about burnout because at the moment we're in a really big staff shortages, so most of them are already doing 12-hour shifts as already like months in. So they're all worried that they're going to burn out. But you are well supported still, and you just got to know when to say no sometimes, and you just got to take care of your mental health and go, okay, money's good, but it's not everything. You do just need to take a step back and go, okay, I need some time for myself. So mental health's a big one, but yeah, just make sure you know, self-reflect. When you need help, raise your hand, debrief a lot, use your support when you're there, but you will see confronting things, and you just got to know, hey, I need a hand. Yeah.
Hi, so to our perioperative nurses, are you able to tell us where to expect, for instance, as a new grad, in a perioperative setting, maybe for their first week, first couple of months, how prepared you have to be, both mentally and, yeah.
Sure, thanks. I had a chat with Olive earlier on today, and it was really nice to meet you. Perioperative nursing is not for the faint-hearted, and I'm being honest with you there. There is no in-between. You either love it or you hate it. It's not for everyone, but it's a very different set of skills that you're going to be developing that you may not have been exposed to as a student nurse. You are very supported. We have a very structured, very supported programme in theatre at Charles Gardner, and we have an excellent staff development nurse team, and one of the staff development nurses carries the graduate nurse portfolio, so she's always available. If she's not available, one of the other staff development nurse team is available to you, as well as the floor staff, the specialist floor staff. You are what we called supernumerary for a 3-week period in theatre, so you're not actually included in what we call numbers. And that gives you an opportunity to learn those skills, those basic skills that you need when you go out onto the clinical floor. So instruments, learning different pieces of equipment, all the safety aspects, risk management, all those kinds of things through support. Very structured, and you're supported along the way with preceptors in every specialty. And there is documentation that we have to be able to document your competencies as you develop through the programme. So there is some of that. That's your responsibility as well as your preceptors. But it's a very structured, supported program. Has
Awesome.
that answered your question?
Absolutely. Thank you.
Thank you.
Cal, online we've got Lauren, just while
Yep.
you're speaking, and she's asked, what attributes do you consider to be essential for a perioperative nurse?
Wow.
How do you
Okay,
think it
okay.
differs from general or world nursing?
Wow. So thanks for the question, Lauren. As I say, it's not for the faint-hearted. I think we're a bit unique as theatre nurses. It's something that I'm very passionate about. We have a very different working relationship with medical staff. I think that's fair to say in the perioperative environment. You're working in a box, basically, in an operating theatre that's full of equipment, lots of white noise in the background. You've got to have amazing communication and listening skills because you're communicating with your eyes, really. You've got a mask on. And the surgeons, I want to put this politely, sometimes they have their moments where they can be frustrated at certain things that go on in an episode, like one episode, say, of the surgical event. You need to know, and you will develop skills to know when it becomes personal and when they're just frustrating. And somebody like me, or somebody like Natalie's got a perioperative nurse background, you just let it go over your head. Some people struggle with that. The days of throwing instruments across operating theatres is well and truly stopped, certainly in my theatre suite, because it'd be my office, basically, if they did that. So it's very different to your experiences being on a ward, because your relationships with certainly medical staff are different. We've also got lots of different craft groups in that environment. As I said earlier, we're not the only care providers in that space. You've got an anaesthetic team. You've got all of your support roles within the suite, as well as your different nursing roles for that one patient at that one time. It's tiring. Wear your TED stockings, get your anti-embolism stockings. You're stood for long periods of time on the wards, and I've not worked on a ward for a long, long time, by the way. Your shift finishes, and hopefully you get opportunities most of the time to hand over to the next nurse or the next care team, and you can go home. In theatre, you can't just say, it's my shift finishing time, you down your tools and away you go. It doesn't work like that. You can't necessarily be relieved because there's an element of risk, because you've got to account for all of your instruments and all of your swabs and all of that kind of thing. So you can't just walk out. So there are times when you have to stay, finish the case, or get relieved as soon as it's safe to do so. So we factor in all of that in our working day. But you are very supported as graduates. Yeah.
Thanks.
Does that answer the question?
Yeah.
Yeah. Thank you.
Being assertive. Any other questions from the floor? Because otherwise we'll move to online. So you might think about some more once we move to online. Okay, so for the collaborative mental health program with Sir Charles Gairdner, I have two questions. One, is it 18 months? And two, do you list Charlie's as a first preference, or we list North Metro Mental Health?
Okay, so in regard to the first question, we are not going to have the 18-month program, collaborative program anymore as of next year. We're just doing a 12-month program with the North Metro Mental Health sites, 6 months in each of the hospitals, either Osborne Park and Mental Health or Charlie's and Mental Health. So if you want to do some general as part of your first year transition program, then please choose Sir Charles Gairdner, RN or EN. The North Metro Mental Health sites is a separate program, which Charlie might like to talk about, which is purely mental health. I think, just to make it clear, when you apply for Sir Charles Gairdner as a registered nurse or enrolled nurse, if you were to get an interview, that's when you preference which program you would like, and that's allocated on a merit base through the process.
Okay. Aska's asking, regarding feedback for selection criteria, what type of feedback is given if it's not question specific? What's the most common feedback given? So I'll answer this in the beginning, and then I'll move to the recruiters. Yes, we're not going to give you specific question feedback. Like I said to young lady before, you can ask what your score is, okay? You're knowing that it's out of 25. All right, you can ask in feedback for your interview, okay, but we can't, there's so many, okay, of you that we can't, spend, drill down to the nuts and bolts of everything and spend, half an hour with every person. It's just to give you some ideas. Sometimes the feedback is just, you had a good selection criteria, but we just had so many applications, okay, so you might then want to tweak it. So sometimes you may not get the exact answer that you want, but know that you could be the next in line, okay? But I'll hand over to some of the nurse recruiters and educators about giving feedback that they've had to before.
Okay, so from my perspective, feedback that I give to applicants while I don't go into questions, the key word in your application is demonstrated. So how can you demonstrate to me that you know and understand evidence-based practice and apply it to the clinical setting? How do you communicate? What tools do you use to communicate? How do you know that you're being effective? So I know what it is, but you've got to prove to me what it is, that you know what it is and that you know how to apply it in the clinical setting. So watch those key words. Demonstrate is a key word.
Just from me, I do tend to break it down like that, but I think it will vary from site to site and from person to person in how you will receive your feedback. Essentially, we will be going through, if you've got questions specifically, I will be trying my best, obviously, to answer those, but if there are no questions, personally, what I would be doing is going to the areas where perhaps you didn't score so highly and giving the feedback on how you can improve that application to give you a better chance going forward.
So Liz is asking, when you say that WA locals have first preference over interstate applicants, how does this actually work? Is it just that applicants for WA residents are viewed first, or the order that interviews are offered to WA locals first? So all applications, okay, are assessed whether you're interstate or whether you're local. And you'll see that on the criteria, it actually says preference for interview and appointment. So if a site has an abundance of applications, okay, over 150, and they've maybe only got 20 positions, they're unlikely then to offer an interview to an interstate applicant, because the chances of them getting offered a position, okay, is very slim, okay? But if you're in a pool and there's only 3 applicants and one of them is an interstate applicant, then you'll more than likely get an interview, okay? If all 3 of those applicants are suitable, the WA applicants will be offered those positions first. I hope that answers Liz's question. Kaylee, sorry, we've just gone blank on the screen. Kaylee's asking, can I just clarify, we don't need to register to GradConnect prior to the application dates opening on the 5th of July. We just need to wait until the link is added on that date and apply through there. Yes. So there's no way to apply now. The link will appear on those during those dates, and then you apply through there. Okay. However, the selection criteria are already up for you to download so that you can start preparing, okay, the answers to those selection criteria. Question for any perioperative nurses. Is there any advice for us students which sets us apart when applying for a theatre graduate program?
So the graduate nurse application process is generic, so there's no theatre specific questions or application process for the operating theatre. I guess what we're all looking for, wherever you choose to apply, we're looking for that passion, that enthusiasm, and if you put that you want to work in theatre because you watch Grey's Anatomy, all I can say to you is you're in for a big shock. And trust me, that's a true story, by the way. I watched Grey's Anatomy. Yeah. So there's nothing specific.
You would be tailoring your interview, what you're responding to interview, possibly at that time to a perioperative. So it won't be your selection criteria application. If you get called for interview, then you can start weaving in, okay, the information and knowledge that you know about perioperative nursing. Sarah is asking, Wax Wheatbelt, do you get ED experience being in small rural hospital or do you rotate between areas?
Thanks, Sarah. Yes, you do get experience in the smaller hospitals. So Wax Wheatbelt is quite a large area, and we're broken up into multi-purpose sites. So the multi-purpose site service sort of individual towns or regions within that town. So those multi-purpose sites will have an ED, they'll have a general ward, and they'll have an aged care attached to them. So if you're at a multi-purpose site and you have an ED, you are the first port of call for any accidents or anything that happens. So a farmer can poke themselves in the eye and they'll come into ED. They can cut off a foot and they'll come into ED. You can have a big car pile up on the Great Eastern Highway and that's where everyone goes. So if you're working at a multi-purpose site as a grad, we've got to make sure your skills are brought up to speed really quite quickly and safely. You shouldn't be left on your own on weekends. So normally on a weekend they'll have a registered nurse and enrolled nurse. So as a first year grad, you shouldn't be on your own for the first 3 to 6 months. D works in Merredin, and in Merredin on night shift, then you are in ED as well. So whatever comes in that you have to deal with. So the graduates have to learn very quickly the skills necessary to work in the emergency department.
I'm just from Northam, and we have our ward and ED separate, but you do have an opportunity after you do your 1 year of graduate program to do a 6 months extension into ED. But just because you've done the grad doesn't guarantee you get that program. It is open for anyone, and it can be quite competitive. But in saying that, on the ward you do get to do your cannulation as well, and different skills like that you would also get in ED. So you do get to see a bit of everything on a general ward. So even if you can't get into ED, you get a really good foundation of skills.
So Ask is asking for Cal again. Does the Charlie's Peri-op area ever take second preference applications? And then being in small rural hospital, or do you rotate between areas?
So we just offer we offer a 12-month graduate program annually, and we offer a February intake and an August intake. We don't offer a second year graduate program.
Second preference.
No, the answer to that is no. Rotating between areas, obviously different specialties, but not between hospitals, no.
Latoya's asking, this is Carol from Armidale Hospital, regarding the 12-month ED program. Is that a program that specialises in ED, or are the grads rotated through different areas, as I'm interested in ED?
So it's a brand new that we're taking ED graduates into ED, and it's 100% ED focused. You don't rotate out to anything else.
So M is asking, at Fiona Stanley within the graduate midwifery program, is there the opportunity for graduate midwives to work in or rotate through continuity of care models such as within the Family Birth Centre?
I'm busted. I'm not a midwife. However, my understanding is that you do rotate through different areas. There's the birthing suites and there's the actual ward area for maternity patients. But if you would like to email me directly, fsfhggradnurse@health.wa.gov.au, I'll be able to ask my midwife colleague who sits next to me, and I can give you lots of details.
Okay.
Can I say at King Edward? Yes, we do.
Get off.
They're trying to poach.
Yeah.
Okay. Akara's asking Charlene from North Metro Mental Health, can you please clarify how the mental health program with North Metro Health Service is spread across the sites? I'm getting confused between the collaborative one with Sir Charles Gardner Hospital.
Yeah, Cara, that's a really great question. There has been quite a bit of confusion about that today. So essentially they are completely different. The mental health program that we offer, you apply to North Metro Mental Health. We've got 6 different hospitals. So Greylands Hospital, the Franklin Centre, Osborne Park, Older Adult, Selby Older Adult, Sir Charles Gardner Hospital Mental Health Unit, and King Eddie's Mother and Baby. So that's our program. Then on top of that, we have an additional program that is the collaborative program with Sir Charles Gardner Hospital. You apply to that one through Sir Charles Gardner Hospital, and that is, you can't apply specifically for that program though, you apply to Charlie's. Within Charlie's, there is the preferencing order of different types of programs that they offer, and the collaborative program is one of those options. So with that program, that's 6 months in Charlie's and then 6 months at one of our sites. Not all of the mental health sites participate in the collaborative program though. At the moment, it's Greylands Hospital and Sir Charles Gardner Hospital Mental Health Unit that participate. Potentially that may expand a little bit, but that's the sites that participate at the moment. So less variety or options. So if mental health is your primary focus, you're probably better to apply for the mental health specific program. But if you're looking for a general program but also like mental health, then perhaps looking to apply through Sir Charles Gardner Hospital.
So Dana's asking a question for everyone. If you've been allocated to a hospital for prac, does this further your chances for getting the grad program? I'll answer that and then I'll move over to the recruiters. No, it doesn't. Okay, we know that not everyone is able to get a prac at their preferred hospital in their preferred specialty. However, if you have a prac at your preferred hospital in your preferred specialty, then you need to utilise the time spent there to learn about what's on offer, to learn the ins and outs, which will hopefully give you an advantage when you get to interview. Okay? So use the time that you have on pracs at all the different hospitals to learn about them, all right, which will give you an advantage if you're going to then be interviewed at that site. But anyone else want to add anything further?
Could I just...
I was just going to say, if you are interested, if you're on prac on going to that hospital, you need to make sure you meet the managers, you're really proactive, go speak to the educators and get a really good, strong reference of like a CN or a manager, because that will really help strengthen your case.
Yeah, and I just wanted to, it's not related to the question really, but just there's been a bit of confusion today about the theatre or perioperative ad that will be up on Grad Connect. It's a completely different pool. It's really only if you absolutely want theatres. If you go into that pool, you won't be considered for any other general program, just to let you know. There's several options within that pool: Sir Charles Gardner, Armidale, Kelmscott, Fiona Stanley, Fremantle, and sorry, what's the fourth one? I can't remember. No, that's it. Is that four? Yeah. And us, yes. Of course us. And Osborne Park, Charlie's and Osborne Park. So yeah, just be clear that if you go into that one, you cannot be considered for other general pools. It's just theatres only.
Yeah. So we're looking for specific dedicated peri-op nurses.
Can I also add that WINS is not involved in that pool, that we do actually have our own separate perioperative program for nurses, but it's very much focused on women only.
So Shona's asking, what kinds of questions may we be asked at the interview? E.g., are we given situations and say that what we would do in a situation? Are you able to give examples, please, to give us an idea? Every site, okay, interviews with their own strategies and tools. Okay, so they don't have a standardised questions. Like I said in my presentation, they're recruiting to the mission and values of their hospital. So it might be scenario specific for you, but it will not be anything more than what's expected of a novice registered nurse, midwife or enrolled nurse. But I'll let the floor take to answer any more of that.
I can expand on the Fiona Stanley Freo perspective a little bit, I suppose. If you think about it, we'll ask you a scenario. We're probably going to want to know what you'll do in some sort of format of patient assessment, because it's the basis of nursing. Another thing that's really important to nursing and midwifery is communication. So there'll be a question in there probably about how you communicate or how you demonstrate or what strategies you use to communicate. If you think about it, there's probably something about you might be able to, there might not be a specific question necessarily, and again, I'm only speaking from Fiona Stanley Freo, and we revise our questions every year, but quality improvement is really important. The national quality safety standards are important. So we might not have a question around them, but if you can work out how to build that into an answer in relation to assessment or communication, then that's going to put you above your competitors. So if you think about the main things that are important to nursing, and again, like Nat said, if you look at our vision and values, you'll get the direction from which we're coming from.
Anyone else would like to?
The only thing that I can think to add to that is that, hopefully you're all aware that the questions are centred around the selection criteria. So although they're not going to be direct, they're the kinds of things that you're going to need to bring into your responses. So just being really familiar with the criteria, having a really good grasp of what that means, and remembering to talk about those factors when you are giving your responses.
One thing that in my first presentation today, and I've just realised I didn't cover in the second presentation, was I see on the social media a lot of people asking, is there somewhere where you can go for someone to do a good CV or a good selection criteria? Now, my advice, is not to waste that money. You'd be better off spending $165 going to the Wanmere Ball next week and networking with the who's who of nurses and midwives, because you need to be. The selection criteria is something that all WA Health employees have to do. So we've all done it. We all still have to do it if we go for other positions. So this is building, your learnings from that. So we have had, and the recruiters will all tell you, they've had applicants who have had someone pay for their selection criteria and their resume, and they get to interview and they can't answer any questions because they actually don't know what was, really put, how those selection criteria came to be formulated. Okay, so my advice is you don't spend the money. Work on yourself in preparing. You've got time now. Okay.
And the time that you spend thinking about your responses to the criteria are actually going to really help you at interview as well. So like Nat says, getting someone else to do it for you is probably going to be a massive disadvantage because it's almost preparation for your interview.
Just with the interview with WACS, ours was scenario based, so we got a bit of time. We got the scenarios, I think we got 5 minutes, then we went into the panel. But I think the main thing I took out of it was you'll get like a set of OBS or something. You just need to be able to recognise what OBS aren't normal. When is there deterioration, recognise it, and who would you escalate to? So what would you communicate? How would you communicate it? And just knowing kind of just recognising deterioration and what's normal, what's not, and when you need to go, hey, this isn't right. I need to let someone know.
So Kara's asking, can you please share, Charlene, what kind of interview process North Metro Health Service uses?
Another great question. So for us, we want to make it as stress-free as it is possible. I know interviews are very stressful, so we do give you preparation time. You'll have 10 minutes with the interview questions, make notes for yourself, you can bring your selection criteria in, so you have that time to sort of prepare yourself, have a little think about what you might like to say before you go into the interview. We generally ask either 3 or 4 questions at interview. We have a 2-person panel, so it's individual interviews as well. Some sites do group interviews, but we do all of ours individually. So we try and make it as stress-free as it possibly can be. Because essentially what you all need to remember, and I think it's something that really anyone should try and remember when they're going through an interview, is the panel actually want you to pass. They want to get the best from you. We don't want to be sitting there and not passing people at interview. We want the best for people. So if you can try and remember that, and that the panel are not the enemy, that will help you keep your nerves in check a little bit and get through the process.
So I'm just going to answer these next 2 questions. Kara, can we apply through Grad Connect and then through the perioperative pool? So what I want to distinguish is Grad Connect is actually just the process, of applying to the different preferences. So if you want to apply to that perioperative pool, which will be, you can either apply through WINS for their perioperative program, better not keep them out, or the combined perioperative pool, which is Charlie's, Osborne Park, Fiona Stanley, Armidale. Is that it? Yep. And you make that one of your preference. Sorry? Perth Children's Hospital as well. So you apply through Grad Connect and you would put that as your preference. Go onto Grad Connect website, Cara, and have a look at where it says participating sites and what you've got designated under each site for RNs, ENs and midwives is all the preferences that will be offered according to that HSP. All right, so you apply through Grad Connect and you outline the preferences of the pools that you want to be considered for. And Kaylee's asking, is it possible to receive multiple interviews? No, because you'll only be swept, okay, to your first preference. So you only get one interview in round one. If there are sites that go to second round and you're not successful in first round, there may be an opportunity for you to attend an interview. But you won't be called up in first round to go to multiple interviews. And can preferences be altered after the interviews based on how we feel we went? No. Okay. After the applications process is closed, we cannot change any preferences because those applications have already been swept to a site. Okay. Yeah. Any questions from the floor? Someone throw the speaker over to the lady at the back. We just need all our online participants to be able to hear the questions.
Katja? Are there any employed model midwifery programs in Western Australia?
Not anymore, no. The last lot of employed students finish at the end of this year, so all midwifery students will be unemployed supernumerary models from that point on. All graduate programs are employed.
Sorry, graduate programs are employed?
Yes, graduate programs you're employed, but all training in midwifery is now not paid employment.
So, there's no paid graduate midwifery programs, though, is there?
Yes, all midwifery graduate programs are employed.
But you have to have done a course already, yeah?
Yes.
Any other questions from the floor? Because we'll be wrapping up about 10 minutes early.
I have one for Mark. What is the WIND program?
So the WIND program was through WACS. It was for nurses who'd only just graduated, so it was for novice nurses. And so they were employed by multi-purpose sites and the hub sites like Northam and Merredin and Narrogin. So they don't have the support that the grads had. So as a WIND nurse, you'd employed and you just counted the numbers and that was pretty much it. But with the graduate program, you actually have the support of the of me.
The WIND nurses, though, were at a lot of the education days that we have throughout the year, so we got to meet quite a few of the WIND nurses, but yeah, like Mark said, they are counted as numbers, so they might come on their first shift ever as an RN and they're the only RN on with an EN. So you are less supported at the beginning, but you do get invited along to the graduate days.
Hi, I've got two questions, if that's okay. Just the first one about interviews, how long they go for, that we're expected for the length of that. And then a second question for the grad nurses, what has been your best moment in your first year of employment?
So interview length for any of the recruiters, interview length?
Look, I would imagine that's going to vary from site to site. I know in previous years some sites have had group interviews that have ran for half a day or something like that. Our interviews are generally 20 minutes. We've just done some for the MH80 that were 15 minutes, quick in, quick out. But it's going to vary from area to area. But generally, most areas, I think, just do 3 or 4 questions. So maybe 20 minutes average.
Probably Charlie's Osborne Park, 20 to 30 minutes, probably 25 minutes more, in between.
However, if you come to Rockingham, you come and spend the day with me because we're at the seaside. So why wouldn't you? Yeah, no, it is actually more or less a full day. It's individual and group activities in the morning, or most of the morning, and then towards the later part of the morning and into the afternoon, it's an individual interview.
So the second part to that question, your best experience, was it, as a graduate nurse?
Yes, your best moments in your first year as a graduate nurse.
In WACS, especially where I'm at, a small site, it's such a diverse range of people that are coming in. Like I said, I work in the emergency department, work on the ward, work in aged care. You're seeing so many people, and especially the same, you're in a small town, the same people come in and out. So everything you do, if you make a change in someone's life, you're going to see them in the community. So I think that's a big thing in the country, is you're respected, and you can see the difference you're making in that town. Like you've got people that were so sick and you thought, oh, they might not make it, but then they've made it and they're back home with their family and they're waving at you when you're driving by or something. I think that's really rewarding. I think that's really special to be a part of such a small community.
Yeah. So we have like a rehab part of our ward, and you get to see them when they come in and they can, it's barely mobile, and then you see them out in town riding their little mower thing, and you're like, oh my God, and then they remember your name, and it's just the most heartwarming feeling ever. But yeah, you get to see that whole patient journey, and you get your regular patients that come in all the time, and you get to build a really good rapport with them and their families as well, which is nice.
Thank you.
Sorry, quick question for you. So let's say an applicant goes through the process and they're selected for an interview, but they're not able to attend the interview. I know I asked this question, I think it was with Fiona. So now just you now, Charles Gardner? Charles Gardner? Yeah? Yes. So what if the applicant is not able to attend the interview? Would anything be scheduled like a Skype or a Zoom, or will they have to be present?
We, as out and on our table, I've got a schedule of when we plan to do the interviews, and it's quite a long time. It's about a week in August. You get the best opportunity if you have a face-to-face interview. Obviously, if we're COVID-free, we might have to rethink that if not. We have offered telephone interviews for good reasons. If you're doing a prac up and say you're up in Broome or you're somewhere offline for a reason, it's not preferable. It's face-to-face interviews. We talk about communication. A lot of it is non-verbal, and a lot of it's body language and that sort of thing, which doesn't necessarily come across on telephone or video screen even. So we do advise that you can come face-to-face and really fit in with the program. It's quite a well-known, pre-planned program, so people are quite well aware now when it happens. So, you do need to be available at the time.
I did have someone actually ask me about when you're rung up, what if you're on placement, and will they ring again? So it's not just a case of, okay, you've been rung up and then you haven't answered, so you're off the list. Okay, the recruiters will do their utmost to be able to get in touch with you. However, you need to be contactable. Okay, so it means that, if you can't have your phones while you're on placement, okay, on you, make sure you're checking them, okay, at break time if someone's left a message, and get back to them during your break time. All the universities are all aware of when interviews are being called. So all you have to do is speak to your facilitator, okay, speak to the nurses that you're working with if you need to organise, time away for an interview. Okay, no one's going to say, no, you have to be here on placement, okay, when you've got an interview for, a job that's going to be next year. So everyone is very supportive of ensuring that, you can attend interviews where you can. Okay. Yep.
The other thing to add to that is that a lot of the WA Health phone numbers will come up as private. We're not scammers. Answer it, take a chance. And the other thing is that you might want to be checking your junk and spam emails, because also we're still legit, but we do quite often end up in your junk mailbox, and so you're thinking that we're not contacting you, but in actual fact we're trying many ways to do so.
Just to add to that as well, to really familiarise yourself with the timeframes that are on the Grad Connect website, it does really clearly specify the start and the end date of the first round. So you'll be able to kind of work out from that as well the times that you're going to need to be available for interviews and stuff. And the Big Red Sky system that we use, some recruiters will be inputting their interview times and getting you to log in and pick your time slot. So most areas will have more than one interview day going. So you may have the opportunity to pick your time slot, but even if you don't, I would definitely recommend that you try your best, as Michelle said, to make it there in person, because it definitely makes a big difference to receive all of that non-verbal. The panel are giving you a lot of non-verbal information, and it's massively beneficial to you to be able to receive that information.
Also, just on that note, just be very careful of your contact email and your referee contact emails as well. If they're not contactable, that the referees particularly, or if you're not contactable, that's a shame. But if your referees aren't contactable, then we're unable to get that part of the process. That is part of the process. Also with referees, make sure you ask them that they are willing to be your referee and they know you and know you well, so they can make more specific comments about you rather than, oh, that was one of the students, I don't quite remember them. You can also use your we don't mind work, I don't know about other sites, but we don't mind work references as well as one of your referees, because that gives us a lot of information about your punctuality, your work style, that kind of thing, which is important to us.
And just a little tip, in that those dates that we give you, that you can be called for interview between late July and August, you can safely assume that in the first week you're not going to be called, because all these recruiters will be busy assessing your applications. Okay, so they're not going to be interviewing in that first week, and they're unlikely to be interviewing in the last week, but they may be. But that first week you won't be called for an interview, I wouldn't have thought.
I'll just add into that as well that for myself, I am one person. So going around making the calls, don't get panicked if you don't hear anything straight away within the first couple of days, because sometimes I just don't have time to get to you all as quickly as you want me to.
Any final questions before we start, before we wrap up? No? Speak now. Forever hold your peace. Okay. Thank you all for coming along.